Welcome to the Man Cave Podcast with Dan Casper.
He is Dr. Austin Crow, Chippewa Valley Orthopedics and Sports Medicine, joining us for another edition of Inside the Training Room. Austin, how you doing there, big guy?
I'm doing great. It's like a heat wave out there.
Yeah, right. No kidding. It's gonna be nice these next few days. Now it's gonna get me ready for baseball and golf and all that stuff. It's gonna tease me.
Not quite. Not quite.
Hey, I want to start off with basketball, and I know it's not necessarily orthopedic such, but I mean Victor Wembanyama, the news yesterday that they've found that he had a blood clot in his shoulder, and he's actually done for the rest of the season. Which, I mean, it surprised everybody yesterday. We saw him at All-Star Weekend this past week, and he participated and such, but. You know, just I guess from your perspective, from an expert's opinion, how big of an issue is that to find a blood clot in somebody's shoulder?
So it is significant. So, I mean, blood clots do kind of fall into the orthopedic realm. We deal with them a lot after surgeries and injuries. So it's something that I deal with on a daily basis. So the first question is why did it occur? Now, we know he didn't have a recent surgery and not a major injury that we're aware of, which are two big risk factors for developing a DVT or deep venous thrombosis, people aka call them a blood clot. They can cause problems in the extremities just in and of themselves. So, you know, what will happen is the clot develops in the veins, so it kind of creates basically like a backlog of the blood. So in this case, the arm will swell. That's probably what they noted, is that he had arm pain and swelling. Then they'll do an ultrasound to look at the veins, and then that's where they found the clot. Upper extremity DVTs are uncommon. They're much, much more common in lower legs or working up into the pelvis. And they're also much more dangerous in the legs. So it's really rare for them to occur in the upper arm, and when they do, it's rare for them to break and go to the lungs. But that's where things get scary, because if the clot breaks off and goes up in the lung, then it becomes what's called a pulmonary embolism, which can be fatal. So it is a very serious condition. The reason why he's being shut down is because the first thing we do when we find a blood clot is put people on a blood thinner. And he's probably going to be on a high-dose blood thinner at first to help break down the clot. You can't be playing basketball with that. If he takes a hit to the head and has intracranial bleed, that'll be fatal. So clearly that's going to be the reason for him being shut down the rest of the season. Now, like I said, the question then becomes, why did it occur? It can happen spontaneously. So just random blood clots can happen. But the concern is that he's going to have a risk factor for them. So there's multiple different conditions that people have that put them at higher risk for that. So certain medications, like I mentioned, trauma, surgery, cancer, and then there's certain genetic conditions. So factor V Leiden, protein CMS deficiency. Those are conditions that people have that put them at much higher risk. And those patients sometimes have to go on blood thinners lifelong, which would be potentially a big deal for him. So at this point, too early to say anything. Again, it's weird that it's an upper extremity, and I'm assuming it's his first clot, because it sounds like, you know, they probably would have said this is the second or third time he's had it. So it's probably less likely that he has one of those genetic conditions, but they're going to do a workup, I promise you. So for now, definitely kind of shocking news. The good news is they caught it, didn't go to his lung, and it's unlikely to do so. So he should be able to get through this, and hopefully it's just a fluke thing, and he gets back once the clot resolves.
So essentially, he's probably going to have to go under a lot of testing, I would imagine, to try to figure out the cause of this. And I mean, it's just kind of a big unknown at this point.
Yeah, correct. Yeah, a lot of question marks. He'll certainly get an extensive blood work, without a doubt. And they may find a reason for it there, and if not, we do chalk these up to these, you know, idiopathic, meaning we don't know why they happen, and sometimes that's what it is. And it's scary for the patient to be like, well, it happened, and we don't know why. I mean, not that you want an answer, because if he has one of those diseases, then he may have to be in a blood thinner lifelong, and then you have to start asking yourself, like, can you be a professional athlete on a blood thinner? That's obviously a risk in and of itself, you know, so that would be hopefully a bridge that they don't have to cross.
I know that because when I first heard that, I thought of another NBA player not that long ago, Chris Bosh. Kind of went through. He had was diagnosed with a pulmonary embolism in 2015, and he could not pass a physical after he attempted to return for that too. And that actually started in his. I was looking this up a little bit earlier, but that actually did start in his lower legs, in his legs there.
Yeah, which is much more common. I mean, I don't know the exact numbers, but I'd say it's at least 10 to 1 legs to arm, at least, if not more. And they're also much more likely to break off when they're in the leg, as they work more proximally. So if the clot's at or below the knee, they're pretty rare that they break up. But if they get up into the thigh or in the pelvis, then they're high risk. And I mean, if a big clot breaks off, I mean, you literally will drop over dead. I mean, what's called a saddle pulmonary embolism. I mean, there's no warning. It is just you are dead. So it's scary stuff.
Yeah, it is. Wow. Switching over to baseball here, because we're in spring training. We got our first games getting set if they haven't already been played and such. There's a pitcher from the Brewers, J.B. Bukauskas, who suffered, the very generic right arm injury, but it required.
Oh, I know exactly what that is.
Required an MRI. It says that he a setback during live EP, underwent an MRI for a right arm injury. Manager Pat Murphy was waiting results before saying more, but probably wasn't going to be an opening day roster candidate. But it's a blow to the club's depth. So I mean, all these pitchers maybe just starting to get ramped up and such. I mean, when it comes to like injuries like these, and you hear these pitchers when they're getting back at it and in spring training, is it a lot of do a lot of these injuries get caused because of that ramp up period? Like maybe, I mean, they're working out in the off season and such, but the fact now that they're throwing harder and maybe a little bit more, is a lot of that just because of that ramp up period? Do you think?
Yeah, I think so. I mean, there's no question about it. In off-season workouts, they are going to push themselves to a certain degree, but I mean, it's a double-edged sword. You can't maintain like a in-season form year-round, or you get overuse injuries for sure. I mean, you're gonna have shoulder issues, elbow issues, absolutely for sure. On the flip side, if you do nothing, that ramp-up phase is very difficult to get back into throwing form. So you always the pitchers have to walk that fine line of saying, look, I need to stay close to game ready without getting overuse injuries. And so this case, it's unclear what it is. I think they alluded to maybe being a triceps injury, which it sounds like he had issues last year. So again, it's that balancing act of you got to stay ready, but you don't want to get an overuse problem. And I mean, we've said it multiple times on the show here, just the mechanics of what a human being is trying to do when they throw a baseball 100 miles an hour is just mind-boggling. And so these guys are really pushing their body to the extreme. So it's just going to be, I mean, that's something that's going to keep us in business as orthopedic surgeons forever. As long as guys are trying to throw a little baseball 100 miles an hour, we're going to have business, because it's always going to create these kind of problems. So whether this is an acute injury or it's an overuse that's just kind of coming to the forefront, hard to say for sure at this point. But, certainly in this window, we're going to see pitchers on every roster start having, those generic terms like shoulder irritation, elbow pain, and with that are going to become muscle problems, tendon problems, hopefully not ligament, but sometimes that you get the UCLs, and those are on their way. I mean, baseball season's going to start ramping up, and as we know, the pitchers and catchers report first, and those are the first guys that start having these things crop up.
I was reading a little bit earlier. There's a player that's with the Mets right now, Matt Allen, and he's a pitcher, but he was one of the a former top prospect. And I was reading he's undergone in the last 21 months. I think it was 21 months, 3 surgeries. It starts off saying one scar runs up Matt Allen's right forearm, a reminder of an operation he'd rather forget. A second frames his elbow, where 2 different surgeons cut in to replace his ulnar collateral ligament. A third on his hamstring, which apparently was to harvest a tendon for his second Tommy John surgery. And it says on here, too, he underwent to transpose a nerve for one of his surgeries for that Tommy John surgery. I mean, that seems like a lot for a guy to try to come back and try to still be a major league pitcher.
You better believe it. Yeah, so all those are related. So the forearm scar is from harvesting what's called the palmaris longus, which is one of the most commonly used grafts for UCL. So we take it's actually the smallest tendon in the forearm, and then if we don't use that, the next place we'll often go is to the hamstrings. So 2 of those surgeries are harvest for the reconstruction. Clearly, he had one that failed. One of the most common complications for a Tommy John surgery is irritation of the ulnar nerve, aka the funny bone. It literally runs right next to our surgery. So usually what we'll do is we'll open up the nerve, move it out of the way during surgery, and kind of lay it back. But sometimes pitchers will have either instability or irritation, we call ulnar neuritis. So, any of us that do a good amount of elbow surgeries, we'll see that. So then sometimes what you have to do is you have to take the nerve, and instead of having it wrapped behind the elbow, you lay it across the front, so it actually lays in more the anterior part of the elbow, and that's called an ulnar nerve transposition. So he basically has had a Tommy John procedure that failed, a revision Tommy John procedure where they took the hamstring, and then the third one is that transpositional ulnar nerve. So it sounds like a lot, and it is, don't get me wrong, but I mean, if you have one fail, it's not uncommon to have it kind of start to domino into these kind of things. But yeah, I mean, it just tells you what these athletes put themselves through. And just what I alluded to, I mean, these guys are trying to put their elbows at the extreme of what the human body can do, and sometimes the human body can't quite take it. So the good news is that surgery does have a high success rate, even in a revision setting. So the hope is he can get back, and after everything he's put his body through, play at that level that I'm sure he wants to be at.
I'm going to frame this kind of in a stupid way probably, but I can't think of a better way to ask this. But, you know, when I was reading that with his harvesting out of the hamstring one, I mean, I've heard about that with ACLs. Is like the hamstring the universal donor of some of these ligaments and injuries or stuff like that?
It is a very commonly used one, and there's a couple different reasons for that. One of them is that we have multiple. So you actually have two of them that run along the inside and one to the outside. And they actually have different sizes. Now, we never take the outside one. We take one of the two inside ones. So the semitendinosus and the gracilis. Gracilis is smaller, so that's one that we'll harvest, for example, for an upper extremity surgery like this. If you need the bigger one, you take the semitendinosus, and that we use, for example, for ACLs. And because it's redundant and because it bounces back pretty well, it is a very commonly used tendon for reconstructions throughout the body. In fact, if we use cadaver ones, often those are cadaver hamstrings as well. So it's a versatile graft. It's long. Because of its size, we can actually use it in its single form, or you can double or quadruple. So basically, you lay it on itself or lay it on itself twice to quadruple it, so it can become small or big. So it is a graft we use very, very commonly. And so, yeah, that is something for multiple reasons that's used quite commonly. Now, there's some tendons in the body that are great. Like for cadaver ones, we can use like an Achilles. The problem is we wouldn't want to take your Achilles because it turns out you need that one. So There are some tendons that we just can't harvest on the human, except in the cadaver setting where obviously the cadaver doesn't need it anymore.
Mm-hmm. Yeah. He's Dr. Austin Crowe, Chippewa Valley Orthopedics and Sports Medicine inside the training room. We appreciate it as always. I'm sure now with the spring training games coming up here, we're going to start to hear more injuries and guys getting banged up and such. So get ready for a lot of pitching questions probably in the next few weeks here.
Yeah, a lot of shoulders and elbows. Yeah, once you're through football season, you get that. But basketball, you'll have some knees and Achilles here and there. But yeah, baseball is all about the shoulder and elbow.
Mm-hmm, absolutely. Well, hey, dude, you enjoy the weather this week. Have a good weekend, and we'll catch up with you again soon. Okay, bud?
Absolutely. You guys have a good one.
You too. Dr. Austin Crowe, Chippewa Valley Orthopedics and Sports Medicine. Quick break, and we're going to bring in Mr. Brandon Berg. We're going to kick it off talking some Brewers baseball coming up after these quick words.